Hi, so a common thing that keeps coming into my office right now I wanted to discuss would be knee pain. So the most common type of knee pain would be what's called a patellofemoral pain syndrome. And what that typically means would be pain right at the kind of the front of the knee and sometimes below the kneecap, sometimes right at the kneecap. It can be anywhere kind of around that area. So obviously if with any knee injury you have to make sure there's kind of the ligament, stability, meniscus, that kind of stuff. We have to rule that out, especially with like skiing injuries, falling injuries, any of that twisting, that kind of thing, which is really common with, can be summer and winter activities, but definitely winter with the skiing. So if you're getting things like kind of that instability, knee giving away, and knee just buckling on your catching, those are some big signs that it could be something a little bit more severe, and especially when it comes after a specific trauma or fall, it's definitely a big concern. But going back to that patellofemoral pain syndrome, so basically what that would be, let me load up here, would be kind of tracking in that knee joint. So if I look, so that's my knee, so that's the patella. It sits in this little groove here, and it should move through that groove. However, the big concern with a lot of this, like especially when you're doing a lot of activity, a lot of these other things can play into it. So typically what happens is that tracking can become a big issue if, one, there's weakness up in that hip that it can't stabilize that knee right in line. The other one can be down at the ankle, where the ankle isn't moving like it should. You kind of rotate out like that sometimes, which will get that knee to kind of dive in, and it's going to create some altered mechanics into that knee joint, which causes some of that pain. So for example, I'll show you here. If I were to do a squat, see if I can get what I'm looking for. There we go. So knee here, and if I go for a squat and my knees are doing this versus going straight over the toes, that can create a lot of different issues in the mechanics of the knee. And so when it comes down to specifics of, sorry, adjusting the camera and everything. So it comes to tension on the knee, it's not necessarily like I started with of a tear of a ligament or like an instability issue, but it's the mechanics that you're creating more tension in certain areas. And that, like I was mentioning before, that can create pain kind of right around that patella because you're creating tension in places where it's not meant to be loaded at as much, and usually can get a lot worse when you're like, oh, I skied the last 7 days in a row, and then the 7th day it finally started to hurt. Usually fatigue will play in a big one, and that's kind of where I mentioned that hip strength can be a big factor to stabilize there. Good news is that conservative treatment, like things that we do here in my office, would be manipulation, mobilizing the knee, Graston or instrument-assisted soft tissue work, cupping, taping, all sorts of modalities, things like that, have shown to be some of the best things to do to create some relief for this issue. So I'm Dr. Darren Howarth, and you're welcome to ask me any questions or come in, have your knee, let's check things out, give you some homework to do, give you some things to work on, assess what's missing there, and get you moving in the right direction, keep you going. So yeah, again, Summit to Shore Chiropractic, thanks for listening, and we'll see you next time.